Hi, everybody, and welcome to this session. We're glad that you could join us for Dr. Pollack's talk about Has My Post-Transplant Journey Been Normal? So I'm pleased to introduce Dr. Pollack, and he's an assistant professor of pediatrics in the nephrology division at Seattle Children's Hospital and the University of Washington School of Medicine. Dr. Pollack combines his experiences and background in information science, in clinical informatics, and clinical practice to improve outcomes of children with chronic kidney disease. Thank you all for being here today. And now, Dr. Pollack, feel free to take it over.
Thanks, Amanda. Thanks for the introduction, and thanks for having me today. I'm really excited to share our work with you all. And so I'm just going to go ahead and get started. So as many of you know, for a lot of our pediatric patients and families that are living with kidney disease, especially those with end-stage kidney disease, the symptoms, complications, treatments, and natural history are unfamiliar. And these unmet information needs lead to uncertainty, and they interfere with goal setting which results in ineffective self-management. And this uncertainty, which has been described as something called illness uncertainty, leaves patients and families wondering if their experience is normal. But to answer that question effectively, people need personal expertise, and they need a clear idea of what normal or even typical means. And this comes from the collective experiences and outcomes of a population of patients with end-stage kidney disease. But it's difficult for patients and families to find this information, given that the prevalence or the number of people with end-stage kidney disease is relatively low. And so the overall goal of our research project is to identify approaches for technology to reduce illness uncertainty by helping people compare and contextualize their outcomes and experiences with other kidney transplant recipients. And so to do this, we first set out to understand the stories and journeys of transplant patients and families, and then build the tools and technology to support an individual to reflect on their own experiences, which would then allow them to compare their experiences to others. And we hypothesized that by allowing individuals to compare their experiences will support self-management and hopefully remove doubt and uncertainty, and may even identify previously unrecognized barriers. So today, I'd like to first just briefly discuss what benchmarking means and how it can potentially help families who are impacted by kidney disease, and then spend the rest of our time sharing my team's work designing a benchmarking tool. So benchmarking is a process of measuring the performance of a company's products, services, or processes against those of another business considered to be the best in the industry or best in class. And really, this is a business concept, and the point of it is really to identify internal opportunities for improvement. Clinical organizations frequently use benchmarking tools to improve the outcomes for their patients, and often use the average performance of a reference group, such as a group of hospitals or different clinical organizations, to look at a specific outcome. And here's an example of a benchmarking tool comparing the length of survival for a kidney transplant recipient across a network of pediatric kidney transplant centers. And you can see the orange line is that average longevity, whereas the blue line would be an individual center. These tools have been really helpful for clinical organizations to improve outcomes for people, but at that organizational level. And so we wondered if we could do something similar for individual patients. Specifically, could we create a patient-facing benchmarking tool designed to help individuals who have had a kidney transplant, and so we can identify previously unrecognized opportunities to maximize their own health and longevity. And so that led us to this project, Pictures for Comparison, where we're trying to create a patient-centered benchmarking tool. And our work was guided by 3 questions, and they're listed here. The first was what questions do pediatric and adolescent kidney transplant recipients want to ask other recipients when comparing their experiences? How do youth want to visually compare things like clinical results, their patterns of adherence or adherence barriers or facilitators? And then finally, how can we design novel visualizations that can support the information needs of pediatric kidney transplant recipients and their families after they've had a transplant? And we set out to recruit transplant recipients and their caregivers who met the criteria that are listed here on the screen, including youth as young as 10 years old. And we also included both English and Spanish speaking participants. And we recruited individuals from our own institution, as well as the Improving Renal Outcomes, or IROC collaborative, as well as from Johns Hopkins University. So the study was divided into 3 components. The first design session was a series of separate youth and caregiver focus groups where participants had an opportunity to ask each other questions about their own kidney transplant experience. The second design session was another series of focus groups where the goal was to create a series of visuals that would support people to compare compare clinical results and adherence. And then finally, in the third design session, we took the designs that were created from the second design session were used to inform the creation of a new set of visuals by the research team on these same topics. And then we showed these designs to the participants in individual interviews to get their feedback and evaluate the design's ability to communicate information effectively. And we did all these on Zoom since we conducted the study during the last few years during the pandemic. I'm really proud to say that we had 30 individuals agree to participate in this study spread across 4 different cohorts. We had 14 youth participants and 16 caregivers. The youth participants' characteristics are here. They ranged in age from 10 to 21 years. 21% were Spanish speaking as their primary language. 70% of our participants had received a deceased donor kidney transplant, and 85% had a previous history of being on dialysis prior to transplant. So remember, in the first design session, it was a series of focus groups, and we had 3 to 4 participants in each focus group, and the focus groups were limited to either youth or caregivers. Individuals had an opportunity to introduce themselves, and then they asked each other questions about their experiences. And I'm going to share some of the questions that they had for each other. First, I'm going to share the youth questions. And the youth questions I've kind of grouped into 2 different categories. The first are more concrete questions, such as, have you had any other medical issues related to your transplant? How have you stayed healthy? Did you want to go to school after you had a transplant? To things that were a little bit more abstract, such as, what's normal for you? Did you enjoy having a kidney transplant, or did you hate it? The parent questions we grouped into 3 different categories. The first was kind of overcoming challenges. Does your child ever express feeling left out of activities that other kids are able to participate in? We had lots of questions dealing with fear. So like, for example, do you ever stop worrying, or when do you stop worrying? How do you, have your own feelings and not, project these feelings onto your child? And then lastly, there were lots of questions about transition, which is totally expected with this group. So the first design session was really set up to be a kind of icebreaker to help people feel comfortable with each other. And the second design session was really kind of the main focus of our work here. And again, it was another series of focus groups with the goal to create a variety of visualizations that would help people compare things like clinical results, specifically like their creatinine or kidney function, or compare patterns of adherence, or like I said, even things like facilitators and barriers to adherence. To help with these drawings, because that's what we asked our participants to do, is that we actually mailed them design kits, which had all the supplies that they would need to complete the task, as well as specific agendas and calendars and so on and so forth. And so I'm going to show you some of the drawings that our participants created here. And so the first task that we had people do was to create a line graph that shows their individual creatinine over time, as well as a perfect creatinine over time. And what we can see here, those first four on the left are those that show their own creatinine, where these two on the right show an example of a perfect creatinine. And it's interesting, you know, basically our participants did what we asked them to do for the most part. They created a line graph, a traditional line graph. But what was interesting was that they annotated the line graph with feelings and emotions. And while we did provide kind of stickers of emojis to them, they also drew some of those concepts in as well. But what I'm going to highlight was that there were some problems with this prompt. We had one youth participant who wasn't able to complete the line graph. They didn't understand what we meant by it, despite us providing them an example. And then we had another participant here who was I believe that was one of our 15-year-old youth participants who drew their perfect creatinine. And while they did indicate that the creatinine might go up slightly over time, and you can see that's annotated by the numbers, the line itself actually goes down. And so we saw some trouble and challenges with using line graphs to communicate this information, which is something that's actually well described in the medical literature when trying to use line graphs to communicate medical information in a variety of different chronic illnesses. So because of those challenges, we changed our methods midway. And so instead of asking subsequent participants to complete a line graph, we asked them to just draw how their kidney function has changed over time and to include a comparison. And here's an example of some drawings that were done by our youth participants. And again, we see lots of emotions and feelings included in these images. And I'm going to just highlight one of the images that was drawn by one of our 14-year-old participants. And I'm going to read to you their description of their drawing. So they said, "This is before and after my transplant. Before, it was getting close to where I'm going to need the dialysis. I got my transplant before I was on dialysis. So I drew this and used the emojis on the side. So basically the green and yellow represents the kidney, the function basically. So the green is like it's functioning how it's supposed to. Yellow, it's functioning, but it's getting worse over time. And red is like you need to go into dialysis or get a kidney before that. And so that's what that represents. So my comparison was to how I was feeling and how my kidney was functioning. Like before, when my kidney was not functioning well, I was not feeling as good. But now after the transplant, I'm feeling a lot better than how I used to." This was a very powerful drawing by one of our parent participants. And this is how they described it. "We know what the numbers or years that he went. And then the question marks is we didn't know anything about what was going on until boom, we found out he needed a kidney transplant, and it just devastated our life, his life. And it's like somebody dropped a bomb on us. And then there's still bombs on the other side with fuses lit because we don't know how this new kidney is going to do. And that's why there's the question marks. It's just the unknown. You know what I'm saying? Because we don't know if it's going to happen again, if he's going to need another transplant. I mean, you can hope for the best and pray, that's about it. And just do what the doctors tell you to do to keep it." Then the last drawing I wanted to share with everybody was this drawing by one of our caregivers from our Spanish-speaking cohort, who used this flower analogy to compare or to describe their kidney function, with a vibrant, beautiful, fully developed flower kind of on the right there, with compared to flowers that are not as well developed or perhaps even dying, to represent kidney function that is not as ideal, which again, I found kind of very moving in listening to their description. So moving on to the next topic, we asked our participants to draw for us our topics on adherence. And so here are some pictures of adherence from our youth participants, showing them being successful taking their medication. And they showed examples of their pill boxes, watches, food. And then some pictures are a little more abstract. Here, one of our participants showed their adherence as a battery, and that when they were doing a great job, their battery was charged 100%. And they even extended that analogy even further by showing how they get support from others, or they described getting support from others to help charge their adherence battery. And then lastly is just an example of one of our participants, how they would drink water and how that water would flow to their kidneys and help keep their kidneys healthy, and so on and so forth. When we asked our participants to draw pictures about things that got in the way of them being successful, there's all the typical things that you would expect to see from our youth participants, such as video games, watching movies. We also heard about, going out with friends and stuff like that. What I found really fascinating was when our caregiver participants drew pictures describing what gets in the way of them being successful, or their children being successful taking their medications. And what was so surprising to me was that all the things that get in the way of their children taking medication are the things that we want our children to be doing in the first place. And it's the reason why they got a kidney transplant was so that they could participate in life to their fullest desires. And so here's an example of a calendar that shows all the days where their child might not have been perfect taking their medication, whether it was late or maybe they forgot. But here you can see there was, they had basketball, or they went to the beach, or they went out to dinner, or they went together with their friends. We had other caregivers talking about going on vacation and how those things all got in the way of being successful taking their medications. So again, I found that very interesting. So the last design session was, remember again, where we took those designs that were from our participants, and we created our own set of designs that tried to capture those topics of clinical results and adherence. And we took those visuals and we shared them with our participants to get their feedback. And then lastly, we asked participants to complete a survey where they shared with us what type of information they'd want to compare in a benchmarking tool. And so now I'm just going to share with you some of the visuals that we as the research team created. So first here was that as a kidney function visual, where we tried to build in that emotional aspect. And so as someone's kidney function is better, the kidney is happy. And then you can imagine as the kidney function gets worse, that happy face might change into a sad face. We also provide comparisons on the right here, where their creatinine kind of translates to basically like a GFR, or a percentage of kidney function, with 100% at the top and 0% at the bottom. And theirs would be represented by a line, and then they could see how their function compares to others or to their peers. And they could see how that changes over time. Participants, I think, found this visual interesting and appealing, but they definitely struggled a little bit with translating the creatinine number with the overall clinical function here. We also created a kidney function visual based on that flower analogy, where we had a flower representing the 5 different stages of kidney function, with stage 1 basically being, the best stage, represented by a healthy, vibrant flower, and stage 5 represented by a not very healthy, kind of dying flower. And how then you could compare your own state to that of a reference population that you could define. We had mixed feelings about this, and I now, after having created it and shared with people, have very mixed feelings and would feel very uncomfortable using this type of visualization to show people, because I cannot imagine how people would feel being represented as a dying flower. I think that would be pretty bad, but it was interesting to get that to use this because it was something that people had described as being interested in. And again, it's something, though, I think that is not something that we would really want to pursue going forward. Here's an example of a visual we created for adherence. We were really focused on helping create visuals that would be actionable. So we wanted to highlight things that interfered with people taking their medicines or help them taking their medications. So we created this scale, and people could drag and drop items from either of those categories into the scale, and whichever way the scale was tipping would be an indicator of how they were doing. We thought it was an interesting idea, but it totally failed. Nobody understood what we were getting at. And in retrospect, yes, it was very kind of complicated. And so we will abandon that idea. We did kind of build a little bit more on this, on the battery concept. And so we kind of created a battery icon where the battery gets charged by these things that kind of that help people to be better about taking their medication, and it might even provide an opportunity to allow people to compare their own adherence battery to others kind of adherence batteries, and then highlight what are those facilitators and enablers, again, to drive those actionable changes. And then lastly, I just wanted to share the results from our survey where we asked people to indicate what type of information they would like to share with others. And here you can see that the youth participants were really interested in sharing things about what types of extracurricular activities they were, how they were doing in school, or how they were able to overall function. But they really were not interested in sharing their clinical outcomes or comparing their clinical outcomes. Whereas the caregivers actually were interested in comparing, everything. So in conclusion, this work has kind of shared or showcased kind of how we would go about building a benchmarking tool for patients who've had and families who've had, participants or individuals who had a kidney transplant and their families. And we learned that that individuals really tied emotions and feelings to their kidney function, and therefore it's really important that our visuals incorporated those emotions. We identified that youth and adults have different information needs. And also, we really need to think about what are the potential negative effects that this work could have, and make sure that we aren't actually introducing harm to our participants. And over the summer, we're planning on incorporating these findings into a benchmarking prototype and hope to share our results with the community in the future. And lastly, I just want to say that if you're interested in participating, we're actually conducting a broader survey right now that takes about 15 to 20 minutes to complete, that would help us to design this type of a benchmarking tool. And for people who are able to go through it, we're offering them $10 for their time. And so lastly, I just want to thank everybody for their participation, as well as thank my team. And that none of this work would have gotten done without them. And because we're almost out of time, I will stop and be happy to take any questions.
So there were a couple of questions. You answered one about the survey. And then the second question was, do you plan to expand this survey beyond the kidney transplant world?
Yeah, that's a great question. Right now, we're just focusing on the kidney transplant population, but I think we'd be open to expanding it to others if people are interested. I think it would probably be a great idea to do that. But at this point in time, we kind of just wanted to limit our scope.
So no other questions, but feel free to throw them in the Q&A. And one other thing that I wanted to mention was, what I appreciate was that you sort of shared the kind of behind the scenes, what worked and what didn't work as a result of these drawings. So I really appreciate recognizing that, does this work, does it not work, and pivoting, because I'm sure a lot of times we don't see the behind the scenes when we read research papers or studies or whatnot. So thank you for sharing that and those learnings.
Oh yeah, my pleasure. Yeah, and it's great, it's important to recognize that everybody has lots of ideas, and it's important to kind of hear and to share those ideas, and then think about what is the impact of those ideas. And so it's good to kind of create an open forum to get people's feedback and stuff like that. I see someone ask the question, do participants get to know one another and become peer mentors? That was actually something that was really, really appreciated during this study, is that the individuals really bonded with each other. And we didn't plan for that ahead of time. And unfortunately, because we didn't have IRB approval to share contact information with each other, it wasn't something that we facilitated afterwards, but they really bonded over this. And we think that is something that is important to highlight in the future. And we would love to figure out how we can incorporate that peer mentorship and those personal connections in this benchmarking tool in the future.
Great, great. Any other questions? Okay.
Oh, sorry. I see one other question in the Q&A is, can people still participate in the survey? Yes, we had some technical trouble with the survey, so we created a new one. So this one is still available. This one is not, right now, it is just to collect the type of information that you would like to share, but is not something that is, you're not able to see other people's responses at this time, but maybe we can share those with this group next year after we've had an opportunity to explore this work in more detail.
That's great. Joseph, is there anything that we're missing?
In the interest of time, well, I'll ask a couple of questions that we had stacked up. One was, how can I find a peer mentoring group for my child who received a kidney transplant, and a peer mentoring group for me as a caregiver? So that was one. I don't know if you could do that address that one quickly.
Yeah, sure. I think that's a great question. I would recommend that you start, well, one with your transplant center, because a lot of them have individuals who are willing to work in that fashion. But I think it should be easier than it is. I am worried that it is not that easy to find those individuals, and I think that is something that we should figure out through this community and other communities, how we can make those mentorships or make mentorship opportunities more available to people. Great. Well, thank you, everybody. Again, I appreciate the opportunity and to speak, and thank you so much for listening to my talk. And I want to wish you all I hope you all have a good rest of your day.
Thank you so much for being here, everyone. And thank you, Dr. Pollack, as always.